Hi, my name is Mick van Nieuwijk and I'm a physiotherapist. In this video we're gonna talk you through the diaphragmatic breathing exercise. Basically the diaphragmatic breathing exercise is good for when you have like COPD or like just problems with your lungs. I can talk you through it a little bit more in depth, but then I do need my flashcards because it's with some quite complicated words. The first one is good against hypoxemia. So hypoxemia means that you have low levels of oxygen in your blood. So in your blood there is oxygen. When the levels are too low, it's not good for you. So when you do the diaphragmatic breathing exercise, then the aim of it is that you get more oxygen in your blood. The next one, and it's really difficult to pronounce, Tachypnea, and that means that it's actually a fancy word for like that your respiratory rate is greater than normal, so your heartbeat is faster than normal. So if you do the diaphragmatic breathing exercise, you can imagine that your heart rate will decrease, what will be good for you. The next one is Atelectasis. That means that the collapse or closure of the lung, and that will result in reduced gas exchange. So a little bit like the hypoxemia, a little bit the same, like low levels of oxygen in your blood, and if you do this exercise it will increase the level of oxygen in your blood. And if you have atelectasis, so collapse or closure of the lung, you can imagine that the oxygen level is lower than normal. Anxiety, well, thank God everybody knows what anxious means. Like, so if you suffer from anxiety, this exercise is also really good. Breathing calmly and paying attention to your breathing will relax and will keep your breathing under control. Then the last point is excess pulmonary secretion, like that's like mucus or like just like saliva, like stuck saliva in your airways. And if you do this exercise, then hopefully that will decrease, so you can breathe in more smoothly. So let's get to it. So the exercise is actually quite simple. It's breathe in through your nose and breathe out through the mouth, but the thing what you do, like that's why it's called a diaphragmatic breathing exercise. Your diaphragmatic is like here. So what you do is like you hold your hands here, and then when you breathe in, you try to push your hands like to the sides. Like obviously they don't go to the sides, they will stick to your body, but to just give you a little bit input from the outside is place your hands on your diaphragmatic place, and while breathing you try to push your hands a little bit out. So like obviously you don't put your hands here, because if you're breathing quite high, like if you're anxious, you breathe quite high here. That's all what you fill your lungs with here. So what you want to do is like to get the air a little bit more from a level lower, like from your diaphragmatic area. That will help you with the breathing, like breathing in a better way. So like especially if you fill the lungs with fresh air down, like not only at the top but at the down part of the lungs, you get more oxygen, more saturation, more like gas exchange if you breathe in and trying to get the air down low as well. So hopefully you find this YouTube video helpful. Please like and subscribe, and best of luck.